Hey there. Today we're talking about something that affects a lot of older adults: erectile dysfunction, or ED. It's that frustrating inability to achieve or maintain an erection. But hang in there, because there are various ways to tackle it and reclaim your confidence. So, what causes ED in older adults? The Massachusetts Male Aging Study found that 52% of males aged 40 to 70 experience ED, and the Boston Area Community Health Survey reports that while 10% of males aged 30, 39 have ED, it jumps to 59% for those aged 70, 79. Clearly, age plays a significant role. First off, let's talk about medications. Older adults often take meds for conditions like high blood pressure, heart issues, or even pain management. Some of these medications can worsen ED symptoms. If you suspect your meds are the culprit, don't stop taking them on your own. Talk to your doctor. They might adjust your dosage or suggest alternatives. Next up, testosterone levels. Testosterone is key for sexual health, regulating sex drive and maintaining blood flow to the penis. As you age, testosterone levels naturally decrease, potentially reducing your sex drive and contributing to ED. So, what can you do about it? Lifestyle changes can make a big difference. Eating a healthy diet, exercising regularly, losing weight if needed, quitting smoking, limiting alcohol, and managing any underlying health conditions like diabetes or high blood pressure can help. Oh, and don't forget to get enough sleep. Feeling a lack of sexual desire? It's common in older adults. According to a 2020 review, about 82.4% of males aged 80 and above report it. Consider seeking help from a sex therapist. It could improve your desire and reduce ED symptoms. Now, let's cover medications for ED. One popular option is phosphodiesterase 5 inhibitors, or PDE5 inhibitors. These help by relaxing and widening blood vessels, improving blood flow to the penis. They're generally safe for older adults, including those with cardiovascular diseases, but aren't suitable if you're taking nitrates for heart conditions. Examples include avanafil, Stendra, sildenafil, Viagra, tadalafil, Cialis, and vardenafil, levetirastaxin. Finally, there's testosterone replacement therapy, or TRT. If low testosterone levels are an issue, this therapy involves administering testosterone through injections, gels, or skin patches. However, TRT won't address common causes like reduced blood flow or nerve damage. In summary, ED is more common in older adults due to several factors like medications, declining testosterone levels, and underlying health issues. If you're facing this challenge, consult your doctor. They can help diagnose the cause and recommend a treatment plan, which might include lifestyle changes, medications, or both. Remember, you're not alone, and there are ways to improve your situation. Thanks for watching and take care.